Hey everyone, I hope you all can hear me. I am coming to you live today from one of our runs in the back. And I'm Dr. Sam. This is my dog Chloe, and she just had her teeth cleaned. She's just recovering from anesthesia here in her nice blankets with her little heating pad. And so Chloe gets her teeth cleaned every 8 months. Her teeth don't really make it a whole year. But I know that there's a lot of people out there that can be quite afraid of placing their pets under anesthesia. It is scary. Anesthesia is not something to take lightly, and we here at University Animal Clinic, we don't take it lightly. We take it very seriously. As an AHA accredited hospital, there are a lot of things that we have to check off the box to be able to provide the high quality anesthesia that we provide here. And I am always of the mindset that you can combat fear with knowledge. So if you are afraid of placing your pet under anesthesia, I want to give you some good questions to ask that will help you feel comfortable that you know that your pet is going to be as safe as absolutely possible under anesthesia. Again, there's always risks, but if we ask the right questions, we can make sure that we are as safe as we can absolutely positively be under anesthesia. So the first question that you should be asking at a hospital before your pet goes under anesthesia is, do you require blood work? That is so important. We can examine our pets from the outside. We can listen to their heart and lungs with a stethoscope, but we can't check that organ functions, how their liver is going to be able to handle and metabolize anesthesia without doing blood work. So that blood work tells me that, are you going to have any bleeding problems when I start doing things to your gums while you're having a dental cleaning? And then can your liver and other organs handle that anesthetic properly? So that's the first question to ask. The second, does your hospital have a nurse anesthetist monitoring your pet that is separate from the nurse that's cleaning the teeth? There are a lot of hospitals and some of these low-cost hospitals and facilities that the nurse doing the dental cleaning is also monitoring the pet. And that's really difficult. A lot of us multitask really well, but when it comes to my pet under anesthesia, I want somebody solely there to just be on the anesthetic monitoring for my pet. And that's how we do it here. There's a separate nurse that is solely responsible for that monitoring. They're with that pet in the pre-anesthetic time frame and also with that pet post-anesthesia. Chloe's been awake for a couple hours now. She's just a pretty sleepy puppy. But there's somebody with her for that good first 30 minutes to an hour after anesthesia to make sure that she recovers properly and that there's no other complications to be concerned with. The second question, does your pet get an IV catheter during anesthesia? This does a number of different things. One, it provides us with that access. So should we need any emergency drugs or anything for those catastrophic, scary times, we want access ASAP and we want it already in place. So this makes sure that we have that. Two, it provides them with IV fluid therapy, which doesn't just keep them hydrated, it also keeps their blood pressure normal. That IV fluids make sure that we don't have any bouts of low blood pressure, which could be detrimental to our heart in the long term. So that's very important to make sure they have an IV catheter. All of our pets here receive an IV catheter when they're under anesthesia. Chloe still has hers, and even in the recovery period, just to make sure that we have access should we need it. The next thing to check and make sure and ask is, are they monitored, and what kind of monitoring equipment are they using? Not necessarily the name brand and all of that stuff, but what are they checking for? You want to make sure they're checking their oxygen, their blood pressure, and an ECG. These things are very important and make sure that we can see that the heart is functioning normally, it's not having any irregular beats or doing anything funny. We want to make sure their oxygen stays stable and appropriate throughout anesthesia, and then making sure that their blood pressure is great. So all of these things are really important while our pet's under anesthesia, and should be a normal quality of care when you're making sure that they're stable under anesthesia. And then the next thing is kind of to ask them to just describe to you the procedure a little bit. The nurse in that room or the doctor should be able to describe everything that's going to go on with your pet. Are they getting dental x-rays? This is becoming more and more the standard of care for our pets while they're under anesthesia, having their teeth cleaned. We're kind of getting past that point where we just look at the tooth from the outside to see if they have to be extracted or not. We want to make sure that the roots tell us the story as well. Just like in people, when you get yours once a year, our pet should have dental x-rays, and Chloe had dental x-rays today to make sure that none of the teeth, that part of the tooth that we can't see, is infected or bad as well. So we know if her teeth should be extracted as well. and then making sure that they have a some kind of scaler and some kind of equipment to get under the gum line. This is the big difference between anesthesia-free dentals, which we could have a whole nother conversation about, and a dental under anesthesia, is making sure that we're getting underneath the gum line, just like they do for us at the dentist, to get that bacteria and things from under there. That's what causes problems later on to the heart and other organs if we don't get rid of that bad material under there. So I hope this kind of gave you guys something to empower you when you go to the vet, whether you're coming here and seeing us and asking these questions, because we can answer them. All of our nurses can answer those questions with amazing confidence that we are doing everything possible to keep your pet as safe as possible under anesthesia. And that you have that kind of background so that you feel comfortable that your pet is as safe as possible. If you have questions about your pet under anesthesia or concerns, leave them in the comments below. I would love to try to answer them if I can. If you have ideas for the next Fun Fact Friday, leave those in the comments below as well. And next month, February, is National Dental Month. Many hospitals are running different events and promos for Dental Month. I know we are here. So if you think your pet needs their teeth cleaned, now is the time to do it. So make an appointment. We'd love to see you. Give us a like and a share. Please get this information out there, because the more people we can help, the better. We want to see our pets with pearly, sparkly teeth. Chloe, did you just pick up your head to say hi? She's not very interested. And I'll see you guys next Friday for the next Fun Fact Friday. Bye.